Good morning. Can you set up an appointment for me to Dr. Ignacio, please?
Sure. What's the reason of your appointment, ma'am?
I've been struggling from having pain near at my chest area.
I'm sorry to hear that. What day is best for you, ma'am?
Thursday are open free for me. Do you have a free slot on that day?
Yes, there's one slot available at 11 a.m.
But I need to pick up my daughter at that time on the school.
How about Tuesday at 1 p.m., ma'am?
That will be perfect.
Okay, that's your all book with Dr. Ignacio.
Thank you, ma'am. Good morning, Doc.
Good morning. What's your name, ma'am?
My name is Kim Mendoza.
Okay, Mrs. Mendoza, what seems to be the problem?
Well, I've been experiencing severe pain near at my chest, and due to that pain, I have find it difficult to go to sleep, even to go to my work.
Okay, I'm going to press your stomach, Mrs. Mendoza. Then tell me where it hurts.
Okay, Doc. That's where it's hurt, Doc.
Maybe in between at the bottom of your ribs and above of your pelvis that you feel so much pain, Mrs. Mendoza. So it appears that you have abdominal pain.
What's that, Doc?
Stomach is referred to as abdomen, so that you have a stomach pain, Mrs. Mendoza. So how long have you experienced that pain, Mrs. Mendoza?
About a week now, Doc.
Okay, do you experience any bowel movements difficulties?
Sorry, Doc, but what do you mean by that?
To make it clear, I ask you another question, Mrs. Mendoza. So is it trouble-free for you to use a comfort room or restroom?
No, I'm definitely having a lot of trouble in using restroom because my chest is really hurts, Doc.
Okay, I noticed that you have a common type of bowel problems, Mrs. Mendoza. So this is so called a constipation. So the main causes of the constipation include insufficient fiber consumption, lack of exercises, and insufficient fluid intake.
Okay, Doc, I'll be honest, I don't usually drink water or even do workout.
Okay, that's the problem, Mrs. Mendoza. So changes to your diet and lifestyle are something that I advise to you. So it is also important that you need to drink 6 to 8 glasses of water every day. And then consider working out at least 3 times a week. And try to eat or take a type of food that rich in fiber, such as fruits, vegetable, and cereals.
Okay, I'll do that, Doc, but if there's anything that you can offer to me just to lessen the pain right now?
Okay, if the lifestyle modification or medication are unsuccessful, I recommend you a medicines. So I advise you to make those lifestyle adjustment. And if you continue to discomfort, I'll offer you a laxatives. So in order to facilitate a bowel movements, laxatives relieve congestion, Mrs. Mendoza. So moreover, if there's no changes for the second time, taking some different type of tests will expected to do. So, but for meantime, you can take a paracetamol to ease the pain.
What kind of test, Doc?
It can be blood tests, CT scan or ultrasound, and then um, urine test, Mrs. Mendoza.
Thank you for the help, Doc. Would you prepare me a medical certification to send it to my office?
Oh, sure, wait for a while, Mrs. Mendoza.
Thank you.
So, this is your medical certificate, Mrs. Mendoza.
Thank you, Doc.
Okay, no problem. Always take care of yourself, Mrs. Mendoza.
Thank you po.
Thank you.